Hello and welcome to NDTV. I am Shubhangi Mishra. In the next 20 minutes, we are going to talk about a disease which has seen an 80% increase in since 1990s, cancer. As per WHO, in the year 2022, 11.6% women globally were suffering with breast cancer. However, if we take proper precautions, we can actually help in the early detection and prevention of this disease. We are joined by a well-known oncologist to talk in depth about the prevention, Dr. Sameer Kaul. Thank you so much for speaking to NDTV. He's a senior consultant at Apollo Cancer Institute, New Delhi. Dr. Kaul, let me begin by asking you, as an oncologist, what advice will you give to the women, especially younger women, if they want to get a checkup for breast cancer?
As far as giving you advice is concerned, I'd say that it depends on, do you have first thing that you need to do is become aware at least about some basic information about breast cancer. If you're young women, and I'm particularly addressing younger women. When I say younger women, I'm saying someone who's between the age of 18 to 45 or between 19 to 37. These are the two kind of, let me say, young age with breast cancer. Yeah. I'd say that be aware that you need to know your history. Do you have a family history of breast cancer? Not only breast cancer. Do you have anybody in the family, particularly on your mother's side, who may have suffered either from breast cancer or from ovarian cancer, particularly breast cancer after 50, or ovarian cancer, or even uterine cancer? Or was there a male member in your family who had breast cancer? You know that males also get breast cancer, so 10% is male breast cancer. Or did anyone get metastatic prostate cancer for that, or even pancreatic cancer at any age? So if your family, know your family history. It's like knowing your family tree, because as we are advancing in cancer treatment, we are realizing that genetics plays a very important role. And we are realizing it now. So be aware if there is a BRCA1, BRCA2 mutation or any of the known mutations. I mean, that's getting a bit technical for you, isn't it? But forget that. Just know your family history. And if at all in the past anyone had bilateral breast cancer, triple negative breast cancer in your family, then you need to know it. Why? Because then you need to be very, very careful with your checkups. Modify your lifestyle. The first thing that you can do is what you eat and what you drink. So when I say eat and drink, I come straight to alcohol. I also like my drink, but then I will be erring if I don't tell you that a woman who takes one drink every day stands 7 to 10% chance of developing postmenopausal breast cancer. Postmenopausal means after menopause. And if she takes, let us say, 2 to 3 or 4 drinks, then her risk of developing breast cancer goes up to almost 20%. So it's such a strong thing, alcohol. If you have to have it within the limits. That's very important. So that's one thing you can do. So that's one thing we must do. Number 2, as per what currently available guidelines, obesity. Don't put on weight more than you should. Get your body dynamics in order. How much should your fat content be? How much should your protein content in the body be for your particular age, for your particular height? Any machine today will tell you, a BMI machine, what is your basal metabolic index. Know that you need to not put on weight, because putting on weight is straight away linked to postmenopausal breast cancer. And what's important is that if you put this weight on after you attained menopause, then the risk is higher. By the way, a risk only means that you stand a more chance of getting it. It doesn't mean you'll certainly get it, as long as you understand that. So, make sure that you're not obese, because not only is obesity linked to breast cancer, it's linked to uterine cancer, to colonic cancer, to male prostatic cancer, so many cancers. Yeah. Now, losing weight is, keeping your weight in check is one thing, which means the fat content. But whether you're having physical activity or not is another independent risk factor, which means, are you exercising? Are you at least committing your body to at least 300 minutes of moderate exercise in a week? That is because that is, as per the guidelines, WHO guidelines, that is what you should be doing. And maybe 150 minutes of strenuous activity if you want.
Dr. Kaul, that's a very important point which you're making, especially lifestyle changes in terms of what you eat, how you eat, where you are, if you're doing proper exercise or not. That's very important for anybody and everybody, be it young women, especially above the age of 50 as well. My next question to you, sir, would be ICMR, Indian Council of Medical Research, in its projection 2022 stated that cancer cases in India are expected to rise from 14 lakh in 2022 to over 15 lakh. I know, as alarming as it sounds, but of course there are preventions, as you are stating. But again, I mean, how we can prevent it, and who and at what age should we get the screening and everything?
Your question is that the ICMR says that in future,
yeah,
the incidence, which means the new patients with breast cancer, is going to increase.
Yes, in 2025.
Well, these are figures actually which come from the Globocan usually. The global cancer count, so as to say, which is usually conducted by the IARC, the Union Against Cancer Control, which is based out of Lyons in France. And we also do our own thing, of course, but they have also projected that up ahead, there are two things that will happen. Number one, the number of breast cancer cases will increase, and there will be a demographic shift, which means more younger women are more likely to get it. As opposed to breast cancer earlier being a cancer of after 50. But over a period of time, we saw that migration. At that point of time, only 10% of cancer overall was early breast cancer, was breast cancer in the young. Mostly it was above 50. And when we were getting trained, we were also taught that woman above 50 is the one who will get it. That was the mindset. But we've seen the migration. So, we've seen teens, adolescents of late coming with these breast cancer things.
Just a follow-up question. Doctor, why is it happening? For the benefit of our viewers, if you can tell, why are younger women, especially in the age group of 20 to 40, why are they getting breast cancer? Any particular reason for it?
Well, I just think that they're so busy with their own lives at that point of time with so much to do, setting up, making up a career, thinking about what they will do in life, facing the anxieties of the future in their own ways. We all do it. So that giving credence to their own body parts is not something that occurs to them naturally.
Yeah.
Number two, people who realize that they have a problem then report it quite late because they fight it a lot at their own level. They don't even immediately go because there are so many things associated with it. So that is happening. Plus, I think the lifestyle factors that have changed, like I told you about, the diet, the junk food that has come in, the traveling around for work, being busy with your work so much, career-oriented, having your child after 30, not falling pregnant till you're 30, which means later marriages and later, obviously, childbirth is something that puts you at more risk of getting the breast cancer. The other thing is breastfeeding, as usual. If you've not done it for a year, then it puts you at some kind of risk to develop breast cancer. It's all about this bad estradiol hormone. It's one of the estrogens that does the bad thing, And so all the occasions and the events and the environment that you provide for this 8-estradiol to work on the endocrine organ of a breast or a uterus for that matter also tries to create a lot of harm. Yes, birth control pills is another one.
I'll just come back to the question which I asked you, Doctor, for the benefit of our viewers who are watching, especially women and be it men also. When do you think is the right time for them to get themselves tested? I mean, if I am 20 or 22 or whatever.
Sorry, interrupting you. That's another reason young women are getting it more and more is because these breast screenings in most of the world start at 40. That is the
Yeah,
answer to your current
yes,
question.
I mean.
So we have to think about this and maybe migrate this a little bit earlier. We do it, we migrate it earlier for women at risk, like I told you, family history or pre-cancerous conditions in the same woman. For those who are at higher risk, and I talked about them earlier, we do it earlier for them. For them, I'd say even 30 is good enough. But because we are doing it, most of the screening in the world happen after 40. The younger women with breast cancer are missing those screenings. So that's one of the reasons that you find this happening more.
For most women, regular breast cancer screening does not begin at least till the age of 40. So in that case, younger women diagnosed with breast cancer tend to have later stage tumors. What do we do in such conditions? Like, is there any which ways we can
Not
reverse
only
the
that,
cancer
not
rate,
only
or-
that, these early onset women don't just have chances of getting their cancer detected at late stages. We also find that they are difficult to treat. For us, they're difficult, more challenging to treat in terms of the psychological input that needs to be given, in terms of the body image and preservation of the organ and so many other things. And their disease is much more biologically aggressive for some reason. And they have a chance of getting triple negative cancers which are more difficult to treat and don't fare so well with treatment. So all these things make it more difficult for them. And psychological input, anxiety, future, body image, depressions, abruption of relationships, abruption of promising careers, a whole lot.
I mean, as alarming as it must be sounding for our viewers, I would take the conversation to a lighter note. I mean, there are people who are suffering from cancer and they are very much, they have suffered it and they are very much out of it and they are leading a healthy and a regular lifestyle. For anybody who is a cancer patient as of now, what suggestion would you give to them?
I just say that the same things that put you at risk need to be kept in your future also. Don't put on weight, don't drink alcohol, have good activity, be a good human being, and get your screenings right, go to your doctor, whoever is supervising you once a while. That's all. And be aware of your body. Keep checking your body, be aware of it. Give your some space for your own health in your own mind, in your daily routine. Put it in your life. Think about yourself. You don't have to only think about relationships. When you think about yourself, think about your body. How is it going to fare? Because this is, believe me, when it starts going wrong, ask people like me who have lived more, then it troubles you. So, prevention is so much better than cure.
Prevention is so much better than cure. I mean, that's the message we should all follow. My very last question to you, doctor, would be not just women, but men also, as you pointed out in the starting of our conversation, are also at risk. And if we look at data by WHO or any data, credible data, cancer is one of the leading causes of death worldwide. Lack of physical activity, obesity, and not following healthy lifestyle are all linked to cancer. Tell us, for the benefit of our viewers, what signs and symptoms of cancer should be, which are more prone to. Like, for example, if you and I are sitting here and talking, even in men, who are more prone to get cancer in their life?
Look at your bodies, check if there are any lumps, bumps, anything. Do you have a family history? I started with the family history. Pichda janam ka pata karo. Find out what happened in the past, because that is so much relevant to the future and we are only just realizing it.
Right.
Much to our chagrin, but we are.
Right.
So find out what is happening in the past in your family. Are you especially prone to any particular cancer? Then you take those precautions. Look at your body, look at your bumps, look at if there are anything in the axilla. Look at a cuff, worry about a cuff that is not going away, or if you're coughing something out which you shouldn't be, like some blood or something, or you have a nagging cough which is not going away. There's a pain anywhere in the body, anywhere for that matter, because you could get, except the nails and maybe the hair, everything can get a cancer in your body. And we do get them. So just be more aware, correct the same lifestyle changes, go for your checkups, give space to health, make a visit to a doctor an important part of your life, believe me. Don't just go to your doctor when your body breaks down, when there is a problem. Dyspepsia, just a little bit of burning sensation, can't just be acidity all the time. Out of 100 people getting that acidity, a couple of them, that acidity would have been because of a gastric cancer. The change in bowel habits, which just happened, worry about it. You're suddenly constipated when you were not. Worry about it. Try and find answers to the aberrations that you face in your daily lives. Just more awareness. Go in.
Thank you so much for speaking to NDTV, Dr. Kaul. I appreciate your time. For the benefit of our viewers, your insightful thoughts were very crucial. I'm very sure for all of the viewers who are watching us right now.
Thank you.
Thank you.